Evan was born in 1989. He was diagnosed immediately with a congenital heart disease. Miraculously, he lived until 17 years old without any intervention. And as Evan began his senior year of college, he had a heart arrhythmia and he passed away. That began our journey into the next phase of life and Live4Evan.
Evan had a tremendous group of friends. 4 of those friends approached us, and that was the beginning of the Live4Evan organization.
Congenital heart disease is the most common birth defect that affects children born in this country. It consists of malformations of the heart apparent before birth developmentally, and so it frequently is diagnosed in the newborn period.
We deal with a lot of patients that come to us struggling to begin with, and then you add a sick child onto this list. It can be extremely difficult.
We see parents kind of struggling with the decision of whether or not they should leave their job so that they can be here at the hospital.
Sometimes they have to make a choice between buying groceries, going to their job, or being at the bedside. They all want to be at the bedside.
So we went in for our 18-week ultrasound, and at the time we were just so excited to find out, are we having a boy or are we having a girl? He said, you're having a boy, and he has a very special heart. And it was just devastating news to us.
Don't plan on going home, which is not what we expected. We did not leave the hospital again for 4 months. The idea of sleeping in an ICU night after night after night, where there's absolutely no sleeping. It's like you're in a war zone.
Every morning when I get here at 7, I walk up to the pediatric ICU, and I've been doing this for 20 years. There are families that are facing extensive diagnoses, and they're in a PICU with other families and critically ill children surrounding them. There's no place for them to sleep. There's a bed space, and it's not because of the arrangement of our pediatric ICU, it's just ICUs. But you see families sitting up all night in the chaos of a hospital environment, because that's what hospitals are.
These are the families that need us more than ever. And then they're given the gift of this beautiful child that they want to support through these really difficult times, and they're having to make these choices. None of us would want to do that.
Being so close by allowed us to give everything we had to being there for him, and it was invaluable.
I think Live4Evan is doing something that so many families like us need, in that we need a place to stay, yes, but we also need to feel like there are people who are walking through life with us.
Health-wise, he's doing great.
He's killing second grade.
Yeah. He's all over the place as far as what he loves to learn. Cars, geography, science, he's an avid reader.
And he's a good big brother, too.
He's a great big brother.
Live4Evan fills this hole that is so important, that can keep families together and keep them going when they are under extremely stressful and intense situations.
We need your help. We're a lean organization, so $100 a night will provide a family with a secure, comfortable place to stay.